Hey guys, welcome back. Today I want to take a deeper dive and talk about eczema. This is a condition as a board certified dermatologist I see and treat on a regular basis in clinic. It affects many of us. In fact, I myself as well as my daughter also suffer from eczema. So I want to talk about what it is, who gets it, why do we get it, and how to best manage this super common chronic skin condition. My name is Dr. Jenny Liu. I'm a board certified dermatologist. I love to talk about all things skin and hair related, as well as do product reviews. So if that sounds good, then I would love it if you can hit that subscribe button and give this video a thumbs up. So what is eczema? Well, eczema is just a term used to describe inflamed, red, itchy, dry, and flaky skin. I think many of us automatically think about atopic dermatitis when we mention the term eczema, and certainly atopic dermatitis is the most common type of eczema, but that is not the only one. There are at least 7 different types, and on a regular basis in clinic, the other ones I commonly see and manage includes hand eczema of different types, and also a subtype of hand eczema called dyshydrotic eczema, which comes in these really itchy, vesicular, fluid-based bumps that I actually sometimes get when I'm really stressed, especially when I travel. There's also nummular eczema, which is a type that is coin-shaped, and that is what nummular means. That comes on the arms and legs. There's even contact dermatitis, allergic contact irritant dermatitis. So there's definitely many different subtypes of eczema. But at the heart of eczema is basically there's compromised skin barrier, there's red, itchy, and flaky skin. So eczema can affect many of us. About 25% of kids will experience eczema, and up to 60% of adults will also experience it. So many of us will have an episode of eczema outbreak on our skin probably at some point in our lives. Now, for the majority, even though this condition there is no cure, it is very mild and often treatable and manageable. But for certain individuals, it can be a very frustrating lifelong struggle and can be very severe that they need a long-term medications for management of the condition. So who gets eczema and why does it happen? Well, there is no simple answer like with many skin conditions. We do know eczema really stems from the combination of genetics and environment. And what I mean by that is it's multifactorial. There's no one cause. What we do know, as I mentioned earlier, at the heart of eczema is there is a defective skin barrier. Our skin is meant to form as a protection, and by doing so, if it's healthy, it's supposed to keep water and moisture in and bad things from the environment out, bacteria, allergens, pollutants, etc. What we see in eczema-prone skin, like atopic dermatitis, for example, is the best studied case, is that there is actually a defect in the skin barrier, ability to not only hold water, but to function as that protective layer. So not only does the skin dry out, it also allows bad things to get in and thereby generates a cascade of inflammation that leads to inflamed, red, itchy skin. So yeah, genetics play a huge role. In fact, 70% of individuals with atopic dermatitis will report a positive family history. So someone, first degree relative, mom, dad, or sibling having atopic dermatitis themselves or have other conditions commonly associated with atopic dermatitis, like seasonal allergies and asthma. Individuals that have all three, eczema, atopic dermatitis, seasonal allergies, and asthma, we call that the atopic triad. And basically what is happening genetically is that we actually see and have identified that there are either enzymes, lipids, or protein that goes into forming a healthy skin barrier that is not working optimally. And because of that, the skin tends to dry out more, and then you are more prone to getting inflammation and then eczema. Genetics isn't the whole story, because we do know that individuals with eczema will have flares, and we have identified environmental triggers that also play an important role. Like, for example, people that have maybe a defect in genetically have dry skin at baseline, but they live in a humid environment all year round, they're way less likely to get eczema or may never even experience eczema compared to someone that may live in a dry and cold environment. Like for myself, in Minneapolis here in the Midwest, when it's really dry and cold in the winter, we see way more eczema, new onset of eczema flare up of pre-existing eczema way more commonly in the winter than we do in the summer. So we do know that environment plays a role, and also stress. Stress creates inflammation in our body, and that inflammation definitely feeds to the inflammation that is happening in our skin. Certainly skincare products and other contact, irritants can all play a role into either triggering or flaring pre-existing eczema. Now, one of the questions I always get from parents that comes in with their kids who have atopic dermatitis, wondering about whether food and food allergies play a major role in the atopic dermatitis. And it's very tricky because, like acne, where we do know that there are associations but not cause, it's a similar concept when it comes to food allergy and eczema. What we do know is this: we do not in general recommend kids avoiding certain food groups for mild cases of eczema. In severe cases of eczema, when it's been appropriately treated by a dermatologist and they continue to flare, food could be considered, and certainly testing or restricting certain food groups if it makes sense, especially if there's known flare of eczema after ingesting certain groups of food, makes sense. And you would have to do that for at least 6 weeks or longer. Therefore, really kids who are not responding appropriately to treatment. But what we also have seen is that even in kids that have a food allergy, and when that food group is removed from their diet, it doesn't necessarily improve their eczema. And similarly, when the food is added back into their diet, their eczema doesn't always flare. So this is where it's really tricky. So if you have a child with eczema, really bad eczema, and you're wondering about food, I think the best thing to do is speak with your dermatologist and talk about what makes sense and what to do next. The other thing too is we do know in kids who have really bad eczema, who are just up all night scratching their skin, who don't sleep well, it is super important to have their eczema controlled, because long term there are actually learning problems and other mental health issues associated from the chronic sleep deprivation. So you're worried you have eczema, what should you be looking for? Well, first of all, eczema is very itchy. In fact, there's a term that describes eczema. Basically, it says eczema is the itch that rashed. So you kind of get in this vicious cycle. The more it itches, the worse the rash looks, and the worse it looks, the itchier it gets. It often presents as a red area of dry, flaky, inflamed skin that is very itchy. Common locations can vary depending on the individual as well as the age of the individual. Like, for example, in babies, we often see them on the cheeks. It can happen on the body as well. Other common locations includes like the front of the elbow, the back of the knee, as well as legs and arms. So it can really happen all over the place. Like I said, it tends to be inflamed, red, itchy, flaky skin. And on extreme cases, the skin can thicken up. It can even get crusty and oozy, and sometimes get super infected with bacteria. Other locations that we see eczema would be like the eyelid. We actually call it the eyelid dermatitis. Often there is a contact component, maybe flared up by cosmetic use or certain skincare products. There's even hand dermatitis, as I mentioned earlier, that can also affect the feet. In elderly patients, we tend to see more like these coin-shaped nummular eczema, commonly on the lower legs and arms, where as we age, because of less lipid production, these areas tend to dry out more and is more susceptible to that type of eczema. Now, eczema is a chronic skin condition, and with that definition, it means there is no cure. However, it can be managed fairly well. In certain individuals who have really bad disease, it can be very frustrating, it can be really debilitating, and can greatly affect one's quality of life. But this is where seeing a dermatologist with the medicines that we have currently, it can greatly improve your skin. But because it is a chronic skin condition, the goal with treatment is really to protect your skin, keep your skin healthy as possible, to reduce the severity and the frequency of eczema flares. So when we talk about managing eczema, I really approach it from a long-term lifestyle modification, and it starts with skincare, and I call it gentle skincare because that's really what you need to do. You need to be mindful of how you bathe, how you cleanse, how you moisturize, and also look for products that are really made for eczema-prone skin, and which I will share in a little bit. It is also helpful to look for products that receive the National Eczema Association seal of approval, because usually those products are formulated for eczema and dry skin, often devoid of common irritants like fragrances, dyes, and common preservatives that may irritate eczema and dry skin. Here are my tips and recommendations or skincare routine for eczema dry skin. Number 1, shower or bathe on a regular basis. Yes, you heard me correctly. There's a lot of misconception about the frequency of showers and bath. A lot of people on social media have said only shower or bathe once a week if you have dry skin. That is actually not ideal for a couple reasons. Number 1, when your skin is dry, any treatments, prescription medications that you may be prescribed, even moisturizers do not work as well on dry skin because moisturizers really help to seal in the moisture. And if your skin is dry, you don't really have moisture to seal in. 2, bathing and showering allows you to remove that dead skin, that crusty dead skin. And in some ways, if you have really dry, flaky, oozy skin, certain type of bath like oatmeal bath can be quite soothing. And 3, when you're showering and bathing, it helps to really rehydrate the top layer of your skin, soften the top layer of your skin. So thereby, when you apply your medications or your moisturizers, it actually penetrates better and is able to more readily seal in that moisture. It's only the fact that if you shower or bathe daily and then you don't follow up with a moisturizer that your skin gets more dried out. So if you have eczema prone skin, if you've ever seen a dermatologist, majority of us do recommend bathing and showering on a regular daily basis if possible. 2, when you're showering or bathing, be mindful of the water temperature. It should be comfortably warm, not extreme hot or cold. Even though hot water may feel really good in the wintertime, it actually can be very irritating and drying out our skin. 3, be mindful of the cleansers or the soap that you're using in the shower. Majority of us really only need to cleanse, like actively lather soap or cleanser in our underarms and buttock area. Unless you have parts of your skin that's covered by dirt, you don't need to actively wash that area. When you are washing, it is really helpful to look for gentle cleansers that are formulated in ways that it works to cleanse but not overly strip your skin barrier. Even the gentle cleanser that are out there, even as gentle as they are, the act of cleansing themselves will strip our skin's natural oil. So even though they're great and what we recommend using when you do need to cleanse, you still want to overall, in general, limit the amount and the location of use if possible. So for cleansing, I really like the following. Number 1, Cetaphil Gentle Skin Cleanser that is in a creamy formulation, it's non-irritating, contains mild, gentle surfactants along with glycerin and other vitamins to help to hydrate and soothe the skin barrier. Another one I really like is from Vanicream, their Gentle Facial Cleanser. This is a really nice one if you're looking for something that is more, that foams readily, but again contains gentle surfactants so your skin doesn't feel stripped afterwards. And Vanicream is a great line because they formulate products for individuals that have eczema-prone skin and those that have, a higher risk of developing contact dermatitis to cosmetic and skincare products. Another one that really like that we actually use in our household is the Lipikar line from La Roche-Posay that comes in moisturizer, eczema cream, as well as a cleanser. And this is the Lipikar AP wash that is really great and gentle, suitable for babies 2 weeks and older. And it contains, La Roche-Posay's thermal spring water, shea butter, and glycerin. And it's just a really nice cleanser with gentle surfactants that also kind of suds and foams. So it cleanses without, again, stripping your skin barrier. And what I love about all the products I've mentioned so far is their number 1 comes in a pump bottle, so really easy to dispense and really is user-friendly in the sense like if you're washing babies and kids with eczema, it's easy to do. And 2, even though they may have the designation of a facial cleanser or it maybe make it seem like it's for body, it's really suitable for all over use. So you can use all of these cleansers on your body and on your face. So it's just nice, like one product that you can have in your household to use on yourself and on the whole family. After bathing or showering, come out of the water, pat your skin dry, and when your skin is still damp, so within that first 30 seconds, no more than a minute, this is where you want to apply a thicker moisturizing cream from head to toe. Reasons why I recommend creams is that individuals with eczema prone skin tend to have dry skin, and so thicker moisturizers tend to have better ingredients, more occlusives to prevent that transepidermal water loss, which is what our skin needs because it tends to lose water and get dried out more. So one of the first products I recommend for those individuals with eczema prone skin and dry skin to use is CeraVe Moisturizing Cream. I mean, this is one of the go-to ones that dermatologists recommend all around for dry skin, eczema prone skin. It is a thick cream that is really helpful at keeping the skin hydrated. It also has not only hyaluronic acid but petrolatum that are great at hydrating the skin, preventing transepidermal water loss, but also contains their 3 essential ceramides and this MVE technology that really helps to deliver these active ingredients slowly over time. Ceramides are super important and has been shown to really help restore the skin barrier. In fact, ceramides is one of the lipids that is lacking often in dry and eczema prone skin. And certainly studies have shown that using moisturizers with ceramides can definitely help to restore our skin barrier and also help to improve eczema prone skin. I also love the fact that this is a very big volume, and again, great for face and body. It is non-comedogenic. Now, if you're looking for something that's a little more lightweight, not as heavy, I recommend checking out Eucerin's Advanced Repair Cream. This is a fragrance-free, as all the products I mentioned today are, lightweight moisturizer that absorbs really quickly without leaving kind of like that sticky residue where some of the creams can feel. Ingredient-wise, it contains urea, lactic acid, ceramides, glycerin, so wonderful ingredients that help to keep the skin hydrated. Urea and lactic acid also really helps to exfoliate gently, so great for like dry, flaky skin, those that are prone to keratosis pilaris, so chicken goosebump skin that we often actually see in association with dry skin and eczema. I personally love using it during the summertime because of the lightweight, fast absorbing texture, but certainly depending on where you live, like for me, I always use a thicker cream in the winter, a lighter cream lotion that's fast absorbing in the summer. But if you live in a warmer climate all year round, this could be a good option for you if you have more dry and eczema prone skin. If you're looking for another moisturizer that's helpful, check out La Roche-Posay's Lipikar Eczema Soothing Relief Cream. First of all, I am a huge fan of Lipikar line in general, as I mentioned. In fact, the Lipikar AP Plus M is our go-to moisturizer for the entire family during the winter. I love it for a few reasons. It's, a big bottle that's in a pump style, so really easy to dispense. I literally pump a couple handfuls after bathing my kids and literally just like lather them in the moisturizer. But it has wonderful ingredients, including, La Roche-Posay's thermal spring water that we know is soothing, calming, glycerin, shea butter, and niacinamide. What is unique about this one is that in addition to those, it also contains 1% colloidal oatmeal. We know that colloidal oatmeal is soothing and calming, and it actually has been shown clinically to help reduce the intensity of eczema flares. So texture-wise, this is very similar to the Lipikar AP Plus M, but has added ingredient of the oatmeal. And I think it's a great one to consider if you are currently experiencing an eczema flare. This moisturizer itself can be very soothing, it's very nourishing, and can really help to reduce the itching and the inflammation from eczema. Another way to really seal in that moisture to keep the skin hydrated and protected is just use an ointment-based product all over your skin or to spot treat. And one that I actually recommend fairly commonly to my pediatric patients and babies is from Aquaphor, the healing ointment. I mean, there are a lot of different healing ointments on the market. I really like this one because number one, it comes in a really big jar, so it's fairly economical. It contains 41% petrolatum along with mineral oil and panthenol, which are great, ingredients that help to seal in the moisture, is soothing. And you can find this in different sizes. So the big jar that you can just literally, scoop out a little bit after bathing and put it on from head to toe. You can find it in like a smaller tube, as well as a tiny size that you can keep in your pocket and in your purse. And I often will use that for chapped lips. But this is great. You can certainly use it like a moisturizer, which is usually often what I recommend to my babies with eczema during the winter. I find it to be a little too greasy to use in the summertime, but certainly can be used all year round. Or you can use it to spot treat areas of dryness. So chapped elbow, dry fingertips, chapped lips, and can even be helpful as a barrier cream. So like for example, it can be used in the diaper area to reduce irritation or diaper dermatitis. The only thing to note is that for Aquaphor, it does contain lanolin. So if you have history of allergic contact dermatitis to lanolin, this would be a product that you would want to avoid. Now, if a multifunctional product sounds good to you, but you really don't enjoy the heaviness and the greasiness of a petrolatum ointment-based product, then you need to check out one of my all-time favorites, which is La Roche-Posay's Cicaplast Balm B5. And you definitely probably have seen this on social media. It's been trending for a long time and for the right reasons. And I actually think this is their most popular product in Europe. It literally is used from chapped lips to dry skin to chafing, avoiding areas of friction like underarms and buttock area, to using it to heal diaper rashes. I've also seen people claim that this has helped to repair their perioral dermatitis, cracked, fissured hands, and corners of the lips. So many different ways of using it. I personally love it for many reasons. Number one, the ingredients are wonderful. La Roche-Posay's thermal spring water. It's got dimethicone, shea butter, glycerin. So great, wonderful skin repair ingredients. Also contains anti-inflammatory and antimicrobial ingredients, including zinc and copper. Additionally, it contains derivatives of centella, which we know are anti-inflammatory and soothing. I mean, the list goes on with all the wonderful ingredients, but I think what makes it really popular and really nice to use is the texture. It is a dense, thick balm, but once you apply it, it absorbs really quick. You can see it's pretty heavy and dense as you're applying on your skin, but once it is absorbed, it does not leave like a lot of residue that some thick moisturizers would leave, and for sure petrolatum would leave on your skin. See, it's very nice, absorbs really quickly. For some individuals, this could be used as like their moisturizer, facial moisturizer, like as needed to really quickly repair their skin barrier. I certainly do not recommend using this on a daily basis, especially if you're acne prone. It is certainly pretty dense, and also for the amount, for the price too. It would not serve well as a daily facial moisturizer, but for those days where your skin really needs a little pick-me-up or intense repair, you can certainly use this to spot treat. It's usually what I do, or use it all over until your skin is better and then transition to your normal moisturizer. And last but not least, if you're experiencing intense flare of eczema and not able to get in to see a dermatologist immediately, you can certainly try Aveeno's 1% hydrocortisone itch relief cream. And hydrocortisone is a topical corticosteroid, and topical corticosteroids are one of the mainstay gold standard treatments that we as dermatologists prescribe for eczema. There are a lot of different treatments now available depending on the severity, but topical corticosteroid cream is one that we definitely use on a regular basis because it reduces inflammation, and inflammation is one of the biggest driving culprits for eczema, for that redness, for the itching. So it really helps to calm down the redness, the dry flaky skin, and the itching. And so 1% hydrocortisone is over the counter. It's certainly mild, and with that, you really can't run into too much trouble using it, but certainly what we were worried about here is that it most likely won't do too much. But for those people who are not able to get in to see a dermatologist immediately, you can certainly try this moisturizer that's pretty gentle and to see if it can help to temporarily reduce the itching and soothe that inflamed skin. And with that said, with this moisturizer, I definitely do not recommend using it all over. I recommend using one of the moisturizers I mentioned earlier as your body moisturizer, and then apply this hydrocortisone cream to spot treat areas that are actively inflamed and itchy. Alright guys, so that is my spiel on eczema and some tips on how you should be caring for your eczema prone skin. Again, I'll be linking all the products below. Let me know if you have any questions on these products or eczema in general. Thank you so much for watching. I'll talk to you guys next time.